two key factors that we need to consider. One is quality and safety of the dental treatment. The other one is cost. Now, quality and safety of treatment in Australia, dentists and dental specialists are governed by the Dental Board, or AHPRA. Overseas, dentists may claim to be graduated from US and also in Japan, but there's no real way to actually identify their true credentials, and also they may not be very good functioning governing bodies on their dental registration. So consumers need to be very careful with that. Another thing with quality and safety is to do with the dental materials and also laboratory use that takes place. In my prosthodontic practice, we only use materials that are TGA approved. We only use experienced Australian trade dental technicians, to do my work. But really, overseas, we have no idea what they are actually offering, And there's a saying, you do get what you paid for, So I think one needs to be very careful in terms of the treatment and the promise made to them and what quality they'll be getting on the other end. In terms of cost of treatment, we need to consider it as financial cost and also biological cost. Of course, initial cost may be cheaper to go overseas, but there is also, if the treatment didn't work out, it needs to be retreated. As a prosthodontist, we see a lot of failed cases overseas. And often these cases could be kept a lot simpler and cheaper to fix in Australia than going overseas, have a mess being made, and then come back and we have to rectify the problem, Now, issue with all of this is that is even if we could fix the problem again. So this is referring to biological cost. When a tooth has been cut, when implant has been placed in the jawbone, subsequent infection resulting in loss of gum and loss of bone, these are irreversible issues. And as a result, us as specialists will try and rectify the problem, but we can never truly repair an irreversible loss of tooth structure and supporting tissues. So what patients also need to consider is not just financial costs, initial retreatment, ongoing maintenance, but also biological costs in the long term.